You know you're a VCU HA alum if you know what MCV means.
You hung out on Cary Street.
You always bounce into someone in the healthcare community that also was a VCU Health Administration alumnus.
If you still call it MCV?
If you stressed over finding a resident or a fellowship, although I didn't stress at all.
You turn around in every healthcare meeting and everyone else is a VCU Health Administration alum.
The Grant House had all of my classes.
100% of my classes were held in the Randolph Minor building.
The majority of my classes were held in the church building with an occasional class on the main VCU campus.
The Grant House.
Our classes were in that small Grant House, and my seat was strategically positioned behind the column.
The Grant House was the place to be.
Dr. Wan's Literal class.
It was operations management taught by Dr. Yasser Askan.
Statistics.
Statistics.
Well, after working all day and coming home and hanging out with the wife and the kids, the last thing I wanted to do was read about health care law.
My hardest class, anybody in my class would probably say healthcare economics.
Oh my goodness, my hardest class was economics.
I think the hardest class we had to take was either Health Econ with Dr. Shi or Healthcare Law and Ethics with Dr. Adams.
My most useful class was a class taught by Dr. Chuck Brindle, and it was healthcare policy and politics.
Hands down, had to be organizational behavior.
And I would say it was probably health law.
One of the most useful classes was actually a professional skills class.
The organizational theory classes taught by Dr. Jim Begun and Dr. Bob Hurley.
Accounting.
Healthcare organizations.
Enjoyable learning and career preparedness. It was great.
3 words.
That was 3 words. It was great.
Okay, all right.
Inspiring, eye-opening, and catapulting.
Tiring, enjoyable, and illuminating.
Rigorous. And then I think the last is relationships.
Laughter, hard work, resiliency.
1, pandemic. 2, intentionality. And 3, self-development.
Rewarding, educational, and stressful.
Make sure you wear a suit.
Remember the human aspect of the healthcare profession.
Yeah. I guess work hard. Have fun.
Never leave a job, always go to a job.
Hands down from Dr. Ken White that it's okay to lead from your heart.
It provided a precursor to what I would experience when it comes to being a leader amongst people that don't look like you.
It gave me the skills to sit around the table with those that I would need to be negotiating for resources, physical and human, and to allow me to advocate for patients in nursing.
The program launched my career. I was able to join HCA and be developed as an executive.
Maintain close personal contact with members of the staff and faculty, especially Greg Prince and Beth Williamson Ayers.
One way is our class founded the VCU Johnson Memorial Golf Classic in memory of our beloved professor, Dr. Johnson.
The most amazing opportunity that I had was the privilege of being faculty in the program for 6 years, teaching as well as serving as the administrative residency coordinator.
I have been a mentor and a preceptor for over 30 years with many students during their residency time or summer interns or people that are thinking about going to the program.
Well, I stay engaged by answering the phone whenever Dr. Song or Beth Ayers calls me and say yes to whatever they're asking me to do.
my 20 years at Virginia Commonwealth University in the Health Administration Department was the best decision I ever made, and it launched the rest of my academic career and gave me much joy in the work that I have been able to do. So thank you, VCU.